Have a great time. Well, straight ahead here on 17 News at Sunrise, could the fish oil supplement you take reduce the risk of breast cancer? Dr. Ravi Patel from the Comprehensive Blood and Cancer Center will have the answers to that question and some more coming up in this morning's month's cancer update. We do that every month, and we'll check in with him in just a bit. And joining us this morning is Dr. Ravi Patel with the Comprehensive Blood and Cancer Center with his monthly cancer update. Good morning, Dr. Patel.
Good morning.
Yes, always good to see you.
Same here.
Yes, we have 3 questions to ask you this morning. The first one, is there a new treatment available for prostate cancer?
There is. Actually, there are 2 treatments coming out, so there's good hope for prostate cancer patient. One is a tablet which stops the testosterone production which fuels prostate cancer from the adrenal gland. So it's a pill form, and it's in the final phases of development, should be out within about 6 months to a year.
Do patients have to get on that pill in the early stages of prostate cancer?
No.
Oh.
That's the good thing, is that if they fail regular treatment, then this becomes a new option for them.
Wonderful.
Yeah.
So that could be given to most people battling prostate cancer.
That's right.
In the late stages even. And the second question that we have for you this morning is, do fish oil supplements reduce the risk of breast cancer? I've heard a lot of great things, a lot of benefits from fish oil. Is this one of those benefits?
So you see, it's a perplexing issue because, you know, eating fish is not the same thing as taking fish supplements. So there's a lot of data that taking fish, 2 servings a week, can reduce, you know, heart disease, breast cancer, and also the mortality related to prostate cancer. But no study has ever been done to show that fish supplements do exactly the same thing, because a supplement is quite different from a whole fish. So there is a study which they are initiating to study fish supplements. So I would say the practical thing is, if you want to take fish supplements, there's nothing wrong, but it's better to take a whole fish and a couple of servings of fish during the week.
And some people are a little scared of fish or a little apprehensive about fish because of mercury levels.
Yes.
But a lot of studies have been saying recently that there's still so many benefits from having fish twice a week, that you should continue eating it. Do you agree with that?
And you know, as long as you don't eat it excessively, there's a good balance, it works out well, actually.
Okay.
It has an overall beneficial effect.
Okay. And the third question for you this morning, is there an increased risk of bladder cancer associated with the diabetic medication Actos?
Well, Actos was approved by the FDA for the use of diabetes, but at that time the FDA said that, look, there's a question of some bladder cancer, so watch for it. And recently there was some evidence which showed that there is a slight increase in bladder cancer in patients who take Actos, but it's not significant. So the FDA said that, you know, patients should not necessarily give up Actos, but they are going to conduct a more detailed study to really see whether there's a relationship or not. So the practical answer to that is no, you can continue taking Actos. It's already been labeled to produce cancer in animals, but not yet proven to produce bladder cancer in humans. But stop smoking if you are, because smoking is a real risk with bladder cancer.
Okay. Well, thank you so much for joining us this morning. Always good to see you.
Thank you. Same here.
Thank you. And we'll see you back next month.
Next month.
And we'll be right back after this.
For Nuno Friday. A Bakersfield family questions how drug studies are done after the death of their son. His cousin, diagnosed with the same cancer, got a new experimental drug. Reporter Carol Ferguson has this story. Carol?
Well, this case is getting national attention and raising some tough questions. Who gets new treatments, and how should drugs be tested?
So basically, in my mind, my son was used so they could get their statistics.
Brandon Ryan, 22 years old, got very sick fast after his first symptoms.
09, last year. He only lasted about 8 months.
Mother Jan Ryan says he'd found a lump under his arm. The family was extra worried because of what just happened to his cousin.
Mine was a mole on my back.
Tommy McLaughlin was diagnosed with melanoma, a type of cancer. Months later, tumors were removed from his right side.
So I got 11 tumors, three of them were cancerous.
He had stage 3 cancer then. It was the next month that Ryan's cancer was found. Same kind, lymph nodes were removed.
He went from radiation into interferon treatment.
We just bragged who had the most lymph nodes taken out.
They tried to stay positive. Ryan was doing okay. McLaughlin was not, but...
Next thing you know, UCLA was contacting me about this clinical trial.
A new drug, PLX 4032. McLaughlin started taking 8 pills a day.
There's no actual cure for cancer, but somehow this actually allows us to stay here a little bit longer.
But by this May, for Ryan,
The interferon wasn't holding it back, and his body was pretty much consumed.
The sad thing is that in melanoma, the standard treatment is terrible.
Dr. Ravi Patel treated Ryan. Treatment options are limited.
He started doing bad and I started doing good. You know, it's kind of flip-flop.
McLaughlin was frustrated when Ryan got worse.
It actually really hurt a lot, not being able to get him help the same way I got help.
Could Ryan get the same super pills? That's what they wanted. And it was a ray of hope when he applied to get into the same drug trial.
They did the testing, and yes, Brandon had the gene. So we were excited.
Ryan was accepted into the trial, but not the way they hoped.
Here I am, I was a stage 4, he was a stage 3. I'm still alive and he's not.
And he was so strong, and it just really kind of crept up on us. It went really fast at the end.
Now, Brandon Ryan got into the trial for the new cancer drug, but he got chemotherapy. It's the next short chapter in this story that raises the family's anger and lots of questions. We'll show you that coming up in our 6 o'clock report. Back to you.
Carol, thank you.
Now let's get a look at what's coming up on 29 Eyewitness News at 6.
If somebody needs it or they're not going to be here, they should be given the opportunity to try.
A young Bakersfield man fights cancer. He wants the same new treatment that's keeping his cousin alive. Both are part of a drug study we investigate in Carol Ferguson's second part of her special report, and shows you what happens on Eyewitness News at 6.
And 2 cousins afflicted with the same type of cancer participate in the same drug trial. Why the tale of 2 cousins grabbed national attention.
Back to you.
Miles, thank you. We'll see you then. A Bakersfield family wants answers after their son dies while taking part of a new study for a new cancer drug.
So we showed you in our 5 p.m. newscast, the young man and his cousin were both in that study. Reporter Carol Ferguson has the story now. Carol.
That's right. The cousin is still alive, taking new pills to fight cancer, melanoma. But Brandon Ryan also got into the same drug study. However, he did not get the pills. He made it for only a few weeks.
How do I feel? Angry, frustrated. People need to change the way this is done.
Brandon Ryan was 22 when he died in June after a short battle with melanoma.
Yeah, these are the super pills.
And that's keeping you alive.
Pretty much.
Tommy McLaughlin, Ryan's cousin, takes these new pills. Now 26 years old, he has the same type of cancer, both diagnosed within months of each other. Ryan got radiation, then got worse. Finally, he also got accepted into the same drug trial, but
He had been randomed out of the trial, which meant he wasn't going to be eligible for the drugs, the super pill.
Ryan was put randomly by computer into the control arm of the study. He would get the old treatment.
Who gives that computer the right to judge who lives and dies?
We knew he was sick. We knew that.
He got 1 dose of the old treatment, got very sick, and back into the hospital.
The day he died, he was talking about going back to work.
They shouldn't have the regulations on who gets to get into the clinical trial.
McLaughlin says he's getting help. Why can't everyone so sick get the new drug?
And that's what drives me nuts every day.
We were all disappointed, along with his family, that he could not get that particular drug.
Dr. Ravi Patel treated Ryan. The standard treatment helps about 15% of patients live a few months longer. The new pills, PLX 4032, have so far helped more than 80% of the patients for about 8 months.
I think that there has to be a way in which a person who has a very rapidly growing cancer can be allowed to at least be given the opportunity of trying a drug which consistently has shown good benefits.
This is what irritates me a lot. It's the politicians of it, like the FDA taking their time to approve something that does save lives.
But even the scientific community is frustrated by things like this.
Dr. Patel says patients and families need to work together and lobby for changes to drug trials in situations like this.
The fact that the story is being heard is making a difference that other people, including Brandon's family, are going to try and make a difference for other people.
Who's going to pay for my kids to go to college? Who's going to make sure there's still a roof over my daughter's head and my son's head?
McLaughlin takes 8 pills a day. He's alive.
Just a walking, talking, ticking time bomb until they find a cure for cancer, but it's all about wanting it.
Ryan died in June, a month after getting into the drug trial, but taking the old treatment.
We're looking into who we need to talk to and what needs to be done, because something definitely needs to be changed.
Jan Ryan is devastated.
We are a very close family, and 1/4 of us is gone. So we miss him every day.
Dr. Patel contacted me last week. He has recently heard that researchers in this study are watching whether patients get surface-type skin cancers using those new pills. He says findings like that are why new drugs are compared to other treatments. But should clinical studies be done differently? That's what the Ryan family wants. Dr. Patel believes there will be changes, but says it may take years. And again, he thinks families and support groups should contact federal officials and drug companies with their concerns. Back to you.
Carol, thank you.